Currently, the Society of the Kingdom of Saudi Arabia is in a heartbreaking state when it comes to the health factor. We are gradually moving towards a complete healthcare calamity. Unhealthy lifestyle, destructive eating habits, and toxic and chemical-laden foods, sodas, and snacks are pushing the entire society to the verge of devastation. Consider some stats. KSA spends $228 billion a year on healthcare. Majority of healthcare expenses for the treatment of preventable chronic disease. 70% of the population is obese, and 80% of people suffer from cardiometabolic diseases. Most physicians are not adequately trained, and there is inefficient allocation of resources. Sick care cost is on an alarming level. In a nutshell, the entire society and physicians are currently focusing on sick care and not health care. Our system is currently revolving around disease treatment and not maintenance of healthy lifestyle. The entire society is divided into three groups: people who are not really aware of the difference between healthy and unhealthy habits; the government's offerings to people who are aware but don't really know where to get help and how; people who are blindfolded with myths about healthy eating. There is a lack of awareness, guidance, and direction for the people who willingly or unwillingly succumb to the evils of unhealthy lifestyle. Thousands of myths have been pushing us into unhealthy habits. Here are some of the most highlighted ones. The USDA food pyramid had us eating lots and lots of refined carbs, leading towards insulin resistance that can have grave repercussions on health. The good and bad cholesterol myth allowed us to intake products that are low in cholesterol and being marketed as heart-healthy cholesterol products. The role of saturated fats in heart diseases is completely misleading. Stats reflect that the risk of cardiovascular diseases has gone up since we have stopped including these fats in our diet. And not just these. Added sugar and artificial preservatives in products push us even more towards such fatal diseases. KSA is in a desperate need of a national program that will lead to rapid risk stratification. But what will it be? Switch from sick care to health care. A reform that would be focused towards creating a healthy and more productive society. People would know exactly how to maintain a healthy lifestyle, what to consume and what not to, and exactly what to do in alarming situations. By educating people and busting the myths, we can reverse the insulin resistance and create a new set of principles that drive us towards being healthier. So here's what the NCD model would look like. Step number 1, measure: history, physical, and diagnostics. Step number 2, mentor: an 8-part integral health program. Step number 3, monitor: each person is monitored for life, lifetime health assessment and monitoring program. So how should it be implemented? Here's how. Hospitals, primary care centers, diagnostics and blood center focus on the measurement phase. Doctors, life coaches, telemedicine, Skype, SMS, phone, social media, and food education for the mentoring phase. Monitoring will include pre-scheduled visits, smart home devices, wearable gadgets, and apps. Motivation phase will include life coaching individuals and family and holding national health competitions. What would mentoring involve? It would involve training doctors and life coaches to educate clients and train mothers so they can bring up healthier families. Educate clients on eating healthier food, such as consuming macronutrients, which includes proteins, fat, and low carbohydrates to control weight gain and reverse cardiometabolic disease onset in a preemptive move. Monitoring would involve 24/7 live feedback. Monitor programs' effectiveness measurement for every client and monitoring effectiveness of each doctor. Monitoring devices would ensure every person is able to check blood pressure, heart rate, lung function, temperature, and ECG easily at home. Implementing the KSA 50/50 pilot project. Phase 1 would include 50 centers, 50 doctors, 50 patients per doctor, 50 life coaches. All data collected and analyzed by Harvard School of Medicine, USA. Phase 2 will include implement the Wellness Wave program in more than 50% of primary care and government hospitals and specialized lifestyle management centers. Results to be demonstrated for clinical and economic impact by Harvard School of Medicine. One of the major focuses will be on the women of KSA, since we believe they are the leaders of their individual family. If they are equipped with healthy habits, their children would follow, and eventually there will be a healthier family. So here's what the results would look like. On an individual level, lifestyle changes, public education towards healthier lifestyle, healthy people, healthier minds, resulting in a healthier and more productive society. On a public level, lower healthcare costs, lower preventable deaths, higher investment in real healthcare but low investment in sick care, better productivity. We move from sick care to health care in an attempt to inspire and motivate people towards a healthier lifestyle. A healthier society will be a happier and more productive kingdom.